Hey folks, it's Dr. Gerstmar with Aspire Natural Health. This week I want to talk on a topic that's just a little bit more technical for you guys. So, in my practice, we are not looking at just diagnosing disease. Of course, if someone has disease, we want to know if it's there. But we're so much more interested in trying to look at the stages before disease, if you want to call it pre-disease, or you want to call it one of the degrees of wellness, moving down from kind of optimal wellness all the way down to disease. We want to detect problems before they're big problems or before they're real problems, so we can treat them, before then and do some real preventative medicine. So one of the tests that we often deploy for people is called the Hemoglobin A1C test. Hemoglobin A1C. Now, those of you who haven't been to an integrative or functional or naturopathic doctor before and don't have diabetes have probably never seen or heard of this test, and it's extremely unlikely that you've ever had it done unless you're seeing, again, someone kind of in the preventative or wellness or integrative medicine kind of sphere. Hemoglobin A1C is commonly used in diabetics. It's another way to measure blood sugar. Now, here's the deal with blood sugar. There really are two tests for the most part that are used. The first is, a blood sugar, often a fasting blood sugar. And what that is whenever the needle is put in, right, if you're having blood tests done, so they put in the needle to draw the blood, or if you're doing, pokes on the fingers, that test can measure what your blood sugar is at that precise moment. So fasting blood sugar is trying to say, okay, at that moment you went in and drew that blood or took that blood from your fingers, how much blood sugar was in your blood and you were fasting at that time, or if you had it done at some other point in the day, then at some point after meals, what did your blood sugar look like? Okay, so that number can vary quite a bit during the day, from fasting or baseline level to the spike that happens after meals, and then anywhere in the ramp up to that spike or the ramp down. So if you're tracking blood sugar over the course of the day, you can see that blood sugar moving around, and that can be completely normal, right? Our blood sugar is not supposed to stay in a straight line. It's supposed to go up and down during the course of the day after we've eaten food, right? So that can make it tricky. Right, looking what a fasting blood glucose, especially if we're just taking one value, like most of us are getting from a regular doctor's visit. We go in once a year and have some basic blood work done, and they include a fasting blood glucose on that test. And what we can learn from that fasting blood glucose is if it's way off, then we know we have a problem. But if it's normal or near normal, then it doesn't necessarily tell us that everything is great, right? Because remember, blood glucose varies from a baseline level to the top and anywhere in between. So it just depends where in that whole cycle your blood glucose is. And since that number changes all day long, if it's normal or near normal, that can either mean everything's great, or it can mean that there's a problem, but it's just not bad enough yet that fasting blood glucose is all messed up. All right, so often we use this other test called the Hemoglobin A1C. And what this is we have something called hemoglobin. It is a big protein that is in our red blood cells. So when we look at the basic test, we have two types of blood cells. A white blood cell, those are all of our immune system, right? And a red blood cell, and those are the little vehicles that transport oxygen around. So every time we take a deep breath, right, we're exchanging oxygen, carbon dioxide, the oxygen's going into all of our cells, and it's the hemoglobin, the protein that is inside those red blood cells, that actually carries the oxygen around, all right? Now, in the normal course of a day, those red blood cells are bumping up against the blood sugar that's in our blood, and some of that blood sugar starts to stick to that hemoglobin inside those blood cells. Completely normal, natural reaction happens to every single one of us. But we can tell when we take out those red blood cells and we look at how much sugar is stuck to the hemoglobin, so that's the hemoglobin A1C, we can get an estimate on what blood sugar looks like. Now, different from the fasting blood glucose, which is literally just a moment in time, what happens is the average red blood cell lives for about 3 months. So we can take how much sugar is stuck to a red blood cell and do some mathematical calculations and get an average value of a person's blood sugar over the last 3 months. So it is a completely different test from the fasting blood glucose because it can't tell us at any one time at all what your actual blood glucose is, but it can tell us the average of what it's looked like over the 3 months. So we try and use these two tests together, both a fasting blood glucose or just a regular blood glucose, which tells us at that particular moment what your blood sugar looks like, and an A1C, which says, hey, over the past couple of months, what does your blood sugar look like? We combine those together to get a much better picture. Now, again, the conventional community tends to only use the hemoglobin A1C when someone is diabetic or pre-diabetic, but it's a test that I use very frequently for people because we're trying to get, if you will, the pre-diabetes, right? Your blood sugar is still technically normal, but it's starting to come out of range. And just like treating pre-diabetes is much easier than treating diabetes, if you will, treating pre-diabetes, which is, hey, we're just starting to see some fluctuations, is even easier than treating pre-diabetes. So again, when we're trying to be very preventative, we're trying to catch things as early as possible. So a few minor tweaks or changes might, cut that thing off at the stalk, right, and have it never become an issue for it. So we use hemoglobin A1C. Now, the whole point of this discussion has been to say, what happens, as I've seen, relatively recently seen a few people who are normal, normal, healthy people, everything else looks good, but when we do their hemoglobin A1C, it comes up suspiciously high. So, has you scratching your head, okay, a high A1C says that blood sugars have been running higher over the past few months, yet this is a person where we're not seeing that blood sugars are running high. So are we missing something? So let's run through this a little bit. Now, breaking this down, there's a great blog post I ran into which spurred me, along with some of these readings from patients recently, to go ahead and record this vlog post. So I'll go ahead and put the blog post that I ran into that spurred this right here. You can check it out, okay? I recommend giving it a read. It's a bit technical, but I still think if you really want to dig into this, that it's worth taking a look at. And it's namely this, okay, when we're looking at hemoglobin A1C, there are always two factors that I brought into play. The first was the higher your blood sugar is, the higher your A1C is going to be. The second piece that a lot of people forget about is an average red blood cell lives for 3 months, right? But what happens if your blood cells actually live longer than 3 months? So we think about it, okay, if they hang around longer, they're going to be exposed to more blood sugar, right? They're going to get more blood sugar attached to the hemoglobin, and so we're going to see a higher amount of hemoglobin A1C, and so when we measure the test, that's going to falsely elevate the level of A1C, giving us the impression that their blood sugars were higher when in reality their red blood cells lived longer. On the other side, if there's a condition which is causing their red blood cells to live a shorter period of time, we're going to see that they had less of a chance to pick up blood sugar, and it's going to show a lower hemoglobin A1C. So it's going to falsely depress that reading. So if we're looking at people who have anemias or they're having some other issues which are causing their red blood cells to break down quicker than normal, then we can see a falsely depressed A1C, which won't accurately tell us what a person's blood sugar looks like. On the flip side, we're seeing in some of these very healthy people, again, theory here, but a healthier system, lower levels of blood sugar, lower levels of free radicals, inflammation, and other oxidative stress mean that their red blood cells aren't going to get dinged up and damaged as much as a normal, or rather a common person that we're seeing in our society, and it seems very likely to me that their red blood cells could live longer, giving us a falsely elevated A1C, right? So those two factors are the ones that commonly look at how much blood sugar a person has and how long their red blood cells live. But this article points out a third factor that I wasn't aware of. And again, I always love learning new information. So it said there's variance in people at a given sugar level, how much of it essentially sticks to that hemoglobin. So it's called a high glycator or a low glycator. So predicted on a variety of factors, you may be someone where you have a certain amount of hemoglobin, a certain amount of sugar, there's the average level of how much is going to stick. And if you're a high glycator, same level of sugar, same level of hemoglobin, more sugar is going to stick to that hemoglobin. Or you may be a low glycator, again, same levels, less will stick. So at the end of the day, when we look at that hemoglobin with sugar stuck to it, we either see more, an average level, more sugar, or less sugar. And again, it could be in the exact same levels of blood sugar. So this means if you're a high glycator, you're going to consistently show higher hemoglobin A1C ratings. And if you're a low glycator, you're going to consistently show lower levels of hemoglobin A1C with the exact same sugar level. So this adds another wrinkle. So backing this all up, the thing that brought this up for me is in otherwise healthy people, no other markers were off here in blood sugar except hemoglobin A1C. And the question was why? Well, one factor could be because their red blood cells live longer than normal. The other factor could be that some of these people are high glycators. So even in the presence of normal sugar levels, they could be turning more of it in, sticking more of it to hemoglobin and creating more hemoglobin A1C than the person who's a low glycator or a normal glycator. So all that's to say that the use of hemoglobin A1C as a predictive measure, like we've been using it, may be a little bit sketchy. So if you're a high glycator, a low glycator, or your red blood cells are living shorter or longer periods of time than normal, right, your test may not be an accurate reflection of what your blood glucose is really like. Now, a couple of good things. So a couple of good pieces, though, is that the inter-individual variation seems to be very low. That is, that whatever your measure is, it seems to be accurate and reproducible for you. So regardless of your score, if you're concerned about it, you're taking measures to have a healthier blood sugar and you see your hemoglobin A1C go down, then you can be confident that those measures have been effective in reducing your blood glucose. So it's not a useless test. It's just we have to take it with a grain of salt. If you're an otherwise healthy person and the only measure that's out of whack is your A1C, hemoglobin A1C, then it is not necessarily a cause for concern. Now, I do want to cover a couple of other factors that we can look for in trying to determine what a healthy blood sugar is for a person. So we've got our most basic, our fasting blood glucose, right? That should be done every year by your doctor. Or you can get a little glucometer, one of those little units with the tabs in them that you do a finger prick poke and collect a little blood. That can tell you what your fasting blood glucose is like. You can also get, I do recommend the hemoglobin A1C. We do have our caveats. So look, all of this isn't to say that the hemoglobin A1C is useless or that you need to throw it away. But like every other test, it needs to be placed in context, right? If everything is pointing to diabetic and the A1C looks like it, then the reality is you pretty much are a diabetic, right? But if everything else looks healthy and one test is a little weird, we really have to look hard at that test and say, is that test really telling us the truth or is something throwing it off? And we've uncovered a few factors today that can throw that hemoglobin A1C off. So we've talked about fasting blood glucose, hemoglobin A1C. I also like to measure, again, this is very rarely done outside of integrative, holistic, or naturopathic practices. I like to look at your fasting insulin as well. So that can give us a clue whether you have insulin resistance. Now, in a perfect world, we do a complicated test called an oral glucose tolerance test. And the only people who regularly have this done are pregnant women where they're looking for gestational diabetes. Right, so this is where you go in fasting, they make you drink basically like this syrup, and then they draw blood over a period of time that generally ranges from about 90 minutes to 3 hours, just depending on the specifics, and they watch your blood sugar over time and how it responds. It's a wonderful test, gives us a tremendous amount of information, but it's a pain in the butt. You're stuck in the doctor's office for a couple of hours. Now, in addition to that, we like to see that that insulin is taken at each of those points as well. So not only are we tracking your blood sugar over time, but we're actually tracking your insulin. It's a tremendously valuable and useful piece of information, but it is rarely done. So in its place, we do like to do a fasting insulin, which can give us a clue what your insulin resistance looks like. So we've talked about fasting blood glucose, A1C, and insulin levels. Now, a little more uncommon, again, especially if we're looking for the A1C is a little weird and we're really looking at it, is checking something called fructosamine. Not a common test, but it is another basically marker in the blood that can tell blood glucose over the past couple of weeks. And it doesn't seem to be is subject to the variation as the A1C is. So if your A1C is weird, you can get fructosamine checked out. Again, most doctors don't run it, but it can be done. But something that can easily be done yourself that I often recommend for patients. So for example, for these patients where their A1C was just a little odd and we weren't really sure, is to do some home tracking of blood glucose. Now you have two options here. The first is just the simple little glucometers, right? You can get them all over the place. Now one of the common questions is, do I need a doctor's prescription to get a glucometer? And the answer is no, you do not. If you don't have a doctor's prescription, insurance will not cover the cost of that glucometer or the strips. But here's the deal, basically, look, insurance really only wants to cover those glucometers for people who are either diabetic or pre-diabetic. Ideally diabetic, but also pre-diabetic. So look, if you don't have diabetes or pre-diabetes, chances are the doctor's prescription's worthless in that case anyways for you, and it's going to be an out-of-pocket cost. Now, the reality is you don't need an expensive glucometer. Right, the little unit. You can get them for free. There are a few. I recommend just doing a quick Google search and finding a good unit for yourself. The cost is the strips, right? I mean, basically, many places will give you a glucometer for free because they want to sell you the strips. Now, you can go online and get these things a lot cheaper, and that's what I do recommend. You can look online, buy them from a reputable source, but you can get them a lot cheaper. And that way you can have some strips to play around with. And typically what I recommend my patients do, if we're trying to check this out, again, perfectly safe, you do them at home, is you do fasting blood glucose for a few days. So that is when you get up in the morning, you go ahead and take your blood glucose, make a note of it, right? That's your fasting blood glucose. Again, it can vary a little bit day to day, so you collect a few data points, do it for at least 3 days, maybe a week, maybe, again, depends what you're trying to do, a couple weeks, but then you're kind of looking at trends and averaging out the numbers to get a good picture of where you are. And then you're doing your post-meal fasting it's not fasting, you're doing your post-meal glucoses as well. So depends how specific you want to get here, but the bottom line is, look, if you do your fasting blood glucose, you pick some representative meals which represent kind of what you're eating, and then about 90 minutes later you test your blood glucose. That'll give you a good sense of what's happening. And you want to see your 90-minute called postprandial glucose below 140. We're shooting below 120, and we're trying to get as normal as we can. That means, you had your spike up and things are normal. You want to see it below 140. Again, this is the standard American units. If you're watching this and you're not in America, then you have to use those crazy, what the whole rest of the world does, metric units, but you can just look at a converter. I don't know them off the top of my head. Below 140 for sure, ideally below 120 and as close to normal as possible. So you can do that for lower carb meals, higher carb meals. So if you want to say, hey, how does this meal or this food affect my blood sugar? You absolutely can do that. So easy to do. You just have to poke fingers. It doesn't have to be as painful as some people think it is. Usually not too big of a deal. You can do it at home. So we've got tests your doctor can do. Fasting blood glucose, hemoglobin A1C, fructosamine, insulin levels, right? Oral glucose tolerance tests. We got tests that you yourself can do. Get a glucometer. Get some fasting blood glucoses for yourself. Do some post-meal, typically 90 minutes, right? Fasting, gosh darn, I keep wanting to say fasting, but 90-minute post-meal or postprandial glucoses, and you can have a real good sense of what your blood sugar does. The last thing is it is possible to get a continuous blood glucose monitor. Again, typically this is only for type 1 diabetics, so pretty much insurance ain't going to happen for this, but if you want to spring for one, last I looked, they ranged about $400 to $600, and it has a little probe, a little needle you stick into into the skin of your abdomen, and this thing continuously monitors your glucose, so you can watch it Typically it's done every 15 minutes, but you can watch it over the course of the entire day. You can watch exactly what happens after your meals. Super cool for the info nerds out there. I count myself one of them. The continuous blood glucose monitors are fantastic, but they're pricey, right? And then you have to buy the probes separately as well. So only for the highly committed people out there. All right. So I hope this has been interesting for you. If you're concerned about blood glucose, and I certainly hope that you are, as insulin resistance, obesity, diabetes, huge. Blood glucose plays a really big role in heart disease, one of the top killers, right? Blood glucose issues also play a role in cancer, right? People with diabetes are more likely to have cancer. Inflammation, Alzheimer's, pretty much most of the bad stuff out there that we're dealing with in the realm of chronic degenerative disease has a link to dysregulated blood glucose and insulin levels. There are tests that doctors can run. There are tests that you can do for yourself. If you are an otherwise healthy person, and your A1C, your hemoglobin A1C comes up high, this data says it is not necessarily something to worry about. So what I would recommend is if you are otherwise healthy, your A1C comes up elevated, get a home glucometer, do some tests. If they come out normal, it's all great. Your red blood cells are either living longer, you're a high glycator, and for a given amount of sugar, you are just packing more of it on that hemoglobin and falsely elevating your tests. All right? Hope this has been helpful for you guys. Please check us out at aspirenaturalhealth.com. That's www.aspire, naturalhealth.com, or facebook.com/aspirenaturalhealth. We focus on treating people with gut problems, autoimmunity, and other hard-to-treat cases. We never give up on our patients, and we are always, always striving to learn more. Just like this, the whole idea of high glycator, low glycator is new for me. Every day I try to learn something new and bring it to my patients. If we can help you out, please feel welcome to contact us. Until we talk again, guys, take care.